We will look at the topic for which you have come today, right learning and recovering childhood. You would have received a little pamphlet and a card. This is the appeal and the covenant we want to make today as parents. I can see there are parents of two generations. My generation who has grandchildren and younger parents who have children. I have made this appeal to parents of my generation to help the younger generation parents who are quite stressed about time, to save a little time for the children. I have titled this talk, Recovering Childhood, Balancing Left and Right Brain. I will first speak about the right brain child a little, because this child is a misunderstood child. Now the right brain child the concept comes from the fact that the right visual cortex is involved in processing visual stimuli and we see. So there are children who are pictorial in their perception, in their absorption, and they like to communicate also pictorially. So obviously these children get addicted to cartoons because cartoons are a very pictorial way of doing life, isn't it? So this concept of right brain children or right brain people comes from right brain being involved in visual processing. But it's only a concept. So the left brain person or the left brain child is able to do management, and the right brain child is very visual in thinking. Did you understand that? So the child thinks visually and child will interact visually. This child is generally good at art, sometimes in music, creative and imaginative already. So in God's design, as I believe, 30% are designed like this. They are children who will be very good in presenting things, for drama, singing, where their world is visual. Now, as you know, even to present what others do, some other people must do. So we have about 70% of the people who can manage systems, do arithmetic and plan work, whereas these children are not very good at planning. So they do things intuitively, they do things suddenly. This is the normal scenario. Remember, I am describing a normal scenario, how children are. So in any class there will be 30% of children who will fail mathematics, even if Einstein comes and teaches. Even if Isaac Newton teaches, that child is going to fail in mathematics. So since one main part of our effort in handling the child with learning difficulty is to get teachers to be sympathetic towards the child who has learning difficulty, and to make parent and child to cooperate together in the learning difficulty rather than get into fisticuffs with each other. Where teacher says, you are spoiling your child, and all the time child is looking at the digital things at home, how can we handle such a child in school? And the parent saying, anyway, it's your business to teach the child. Without having that confrontational situation, what we like to do is get the parent and teacher to work together, offering solutions. Now if parents are not given a solution to the problem, you all are parents, isn't it? What do parents do? They deny the problem. Because our child, my child, what are you saying? My child, problem, my child? You are saying this of my child? And parents will be quite willing to do battle to death because my child can't have a problem. But if you speak to parents from the point of view of a solution, they will be willing to acknowledge the problem. Did you understand that? So what I have done is, some schools have invited me to speak to teachers. Some schools got their got their, let's say, grade 6, 7, 8 children, teachers and parents together for 2-3 hours. So it was a big crowd, but they felt it's worth the effort to bring this harmony between managing the child who finds difficulty in classroom learning. So we are appealing to schools that difficulty in classroom learning is a phenomenon of the times. You have to factor that in, schools have to factor that in. So our appeal is also to schools to factor in that there are children who are digitally affected or otherwise affected, and classroom learning has become difficult, so classroom teaching has become difficult. So no point looking for the ideal world, the good old world. When the children are like this, we have to work with the world we have. And with parents, we are pleading with parents to get more time, to give more time for the child. Now I will go through systematically after this introduction. So I have just given you a description of what this right brain child is, naturally speaking. Now I get to the triad of the problem that we are looking at today. Next slide. The triad of the problem of the child is this: inattention, impulsivity and hyperactivity. Usually these children get diagnosed as ADHD, ADD, attention deficit hyperactivity disorder. Now I am of the medical school that want to delist that diagnosis and not label children as ADHD. Now this is different from autism and different other learning disabilities. So what doctors normally diagnose as ADHD is a child who is inattentive to normal school studies and impulsive. That is, even when the child is not actively doing something, inside him there's a momentum he can't contain. Inside him he is bursting at the seams. Thirdly, hyperactivity. And most easily understood thing about this child is their increased motor nature, so that they don't stop like a normal child. These children will run and screech to a halt. Have you seen that? They screech to a halt. They can't do things normally. So when they want to pick up something, even if parents say pick this up or bring something, they'll either disobey, or if they obey like this, they'll go do this, they'll do a dance, they do something else, then they'll take the bag. That's how they behave. Did you understand that? So these children get diagnosed as ADHD, and usually father is too busy watching Sangakkara getting his 200. So he will tell the mother, go and do something. Teacher is saying things, go and do something. So if you take him to a normal family physician feels this is too much for them to tackle, so they will ask you to take the child to a psychiatrist. If you go to a younger psychiatrist, he will prescribe drugs, and drugs will put the child in a chemical prison further. So our empathic learning therapy is very simple to understand. Empathy with the child in the way the child will package information. So if the child is pictorial in his perception, give him pictures to begin with. If the child is already overwired in the right brain, enter through the child's right brain with right brain absorbing programs and train the child's left brain. If you understood that, will you just give a wave of a hand? So if the child is already very alerted in the right brain, very active in the right brain, you enter through the child's right brain and get the child to do left brain activity. Now how do you do this practically? What we do in our empathic learning center, our staff is trained for this. They will show a video for 10 minutes of a story. So the child watches the story likes to watch stories. Then they stop and say, now make what you saw. And our staff will work with the child, and the things are prepared. So let's say it's a story with lion and lion's den and a man and lamb or whatever. All those things are prepared, and the child begins to cut and paste and make, and the child will make a very beautiful picture at the end of it. Can I have some stuff from our empathic learning center which have been already made? Child will see the way what he likes to see, and then it stopped, and the child will do things that he normally will not like to do. Now with parents, when they come to see me on a Friday, I will take about 30 to 40 minutes with every parent. They think they are coming to show me the child. Actually what I do is, I listen to the parents, their pathos, their difficulty, their sorrow with the child, their anger with the child. I listen to the parents, and I actually treat the parent to do things that the child can do. And different systems we teach the parents. That is what empathic learning therapy is. Start with what the child can do. Now these are some things our staff has made with children. It's all made with the children. They see different stories and they make different things. So they like to see, they don't like to sit and do. But because we involve them in a story that they see, they cut and paste and make quite a lot of quite nice elaborate things, isn't it? So this gets them back to eye, hand, brain coordination, which they might have missed for a long time. Now, so what do? We relearn, we get them to relearn, remanage and retrain. So what's the problem? Inattention, impulsivity, hyperactivity, which is normally medically diagnosed as ADHD, attention deficit hyperactivity disorder. We delist that diagnosis. We try to get it out of the minds of the parents. Even if the parents have gone to a doctor and had treatment for a long period of time, we try to tell the parents this can be managed without drugs. Of course, you know when someone is on drugs, you can't stop this. Now, this is not my innovation. Empathic learning therapy was pioneered the world over by a doctor called Dr. Daniel Amen. He's a Jewish chap, that's why that name. And a Dr. Peter Brenning. So even in Sri Lanka, a certain professorial pediatric unit, they manage children for 6 months very well without drugs. So it is doable. Only thing, it's staff intensive, and parents have to help in this process, isn't it? Because this is a behavioral problem. This is a child's learning difficulty. That can be, and a child is in school for about 5 to 6 hours, and 19 hours child is at home. So parents have to get involved in managing the issue. So we tell the parents, do what we give you to do with the child for 40 days. Because any bad habit to be removed and a good habit to be inculcated, you need 40 days. Now, if the parent is so busy that he can't take, and 30 minutes for 40 days. We are not asking a lot from parents. Do you think any parent should give 30 minutes a day for 40 days for a child? But there are parents who think they can't. So we reduce to then, we prefer to parents to give 1 hour for 40 days. If they say can't give 1 hour, we say give 20 minutes, give 30 minutes for 40 days. If they say can't give it for 40 days, we say please give for 20 days then. So during that time, what do we do? Next slide, I have explained a tipping point. That is, here are some of the factors that produce this digitally excited state. Some children are affected in the womb itself. And they are most severely affected when they are affected in the womb, when the fetal brain is affected by this wrong brain wiring or hyperexcitability of the brain. They are more affected than children who produce these symptoms after birth. Did you understand that? After birth, there's a certain tipping point. Now, for those children for whom this inattention, impulsivity and hyperactivity are the result of digital overexposure,